do have Spanish interpretation available today, so I'm going to ask our interpreter to provide instructions.
Sí, la siguiente presentación tiene servicios de interpretación al español. Para iniciar esta función, hágale clic en el icono de interpretación, seleccione español como el idioma indicado. Es opcional para escuchar solo el audio en español. Haga clic sobre Mute Original Audio.
So I'm going to ask all of our audience members and panelists to choose a language from the interpretation bubble, English or Spanish. That'll just make things easier as we move forward. So at this time, if you can choose one of the languages. All right. So with that, we're going to go ahead and get started. Next slide. So we do have closed captioning available as well. Instructions are on screen. I invite those of you who need to use closed captioning to please go ahead and do so. You'll notice we also have ASL available tonight. Next slide, please. So as I mentioned, this is our MPX town hall. This is our first community town hall on the subject of MPX. The MPX is what is formerly known as monkeypox. And so today you're going to hear from our public health department director, Kimmy Watkins-Tart, Dr. Eileen Dunn, our our operations lead on MPOX is going to give us an overview of MPOX and the data. You're going to hear from Deputy Director, Dr. George Ayala, about our public health response, what's going on with vaccine and treatment, and some of the challenges that may occur, as the response moves forward. So you may notice that the Q&A function is turned on your screen. That's how we'll be taking questions today. So we encourage you to use that functionality to share your questions with us, because once the formal presentation is over, we will be taking your questions and asking our presenters to respond. So with that, I am going to ask Director Kimmy Watkins-Tart to provide her welcome remarks.
Thank you, Neetu, and welcome everyone to our first town hall on MPOX. The Alameda County Healthcare Services Agency has a mission to ensure that all the residents of our county stay healthy and safe. And having this town hall is a key aspect of reaching that goal. As with COVID-19, a critical part of our response is to communicate with the public and to ensure that those most affected by MPOX are served appropriately. And so we hope that during this conversation that you leave with a lot of your questions answered, and you are able to ask questions. We really encourage you to use the Q&A portion of this meeting to ask the questions that you have. I think we'll go ahead and get started with the other parts of some of my comments I'd like to share with you. Next slide, please. So I wish that I could say, when we were responding to COVID-19 in past tense, but what's real is that COVID is still with us as well. And so what is a bright spot, if you will, is that we've learned a lot along the way, and we feel well poised to really respond to MPOX. I've listed here some of the few lessons. There have been many from COVID, but these are some of the things that we feel are critical in making sure that we get off on the right foot in responding to this. The first and foremost lesson was really that we really needed to work closely with community partners in our response. You all are partners with us. We have certain responsibilities that we carry out, but we cannot do that without our partners. We also make sure to follow the data. When we veer from what the data is telling us, it really starts to compromise our response, and it compromises our ability to reach those who are most impacted. As with COVID, we are prioritizing those communities that are disproportionately impacted. We also learned to closely coordinate with the California Department of Public Health and the other health departments in our Bay Area region. While we will always center what's important for Alameda County, we also must align and should align with our state and be in alignment to the degree possible with the other counties in the Bay Area. We know that this is a region, and many of us work in one county, we live in another, we might have family members and children who are going to school in another part of the Bay Area. And so to the degree possible, as I mentioned, we really try to work as a team in this Bay Area region. We also want to ensure that we are leveraging the public health expertise that we have in incident response. We have already started establishing community vaccination clinics. And as with COVID, those have been critical places to not only vaccinate people, but also to share information, to answer questions, to engage people, and to better understand how we can improve the quality of our response. Developing guidance that serves both those who are disproportionately impacted as well as the broader community is a large part of our effort as well, and critical to ensuring that you all have the information that you need. Last but certainly not least, we have learned and continue to learn the importance of cultural competence, sensitivity, responsiveness, and relatability, and also language accessibility. We have to make sure that all members of our community are included in all that we are trying to do. And so with that, I'd like to turn this over to our next speaker. Thank you.
Thank you, Director Kimmy Watkins-Tart. So with that, I'm going to welcome Dr. Eileen Dunn, who is leading our operations for the MPOX response for Alameda County. Thanks, Dr. Dunn.
Thank you and welcome. I'm going to be talking about MPOX overview and data updates. Next slide, please. So monkeypox or MPOX is a rare disease caused by infection with the monkeypox virus. It may start with flu-like symptoms such as fever and or chills, headache, muscle ache or backache. There can also be swollen lymph nodes and fatigue. Then the skin rash may develop, and it can be located anywhere on the body, but in this outbreak has been commonly located on or near the genitals, in the mouth and anus. It can be a red bumpy rash with a dome that has a sunken center. It can be blisters or pustules. Upon healing, the rash will result in scabs and skin healing. The rash has also been noted to be painful or itchy for some patients. Next slide, please. So how is MPOX spread? Any person of any gender or sexual orientation who has close or intimate contact with an infected person can get MPOX. MPOX is primarily transmitted in certain ways: direct skin-to-skin contact with the rash, scabs, or body fluids of an infected person; intimate contact, including kissing, hugging, sex with a person with infection; sharing unwashed bedding, towels, and clothing with an infected person; or prolonged close interactions, such as those that may occur in a household or living situation. Next slide, please. As of August 25th, there have been 167 people in Alameda County with MPOX infection. Currently, most people with MPOX infections are ages 18 to 40 years, are cisgender men and transgender people, are gay men, bisexual men, and other men who have sex with men. 42% are Hispanic Latinx, 69% live in low-income neighborhoods, and 64% live in Oakland. Next slide, please. So what can county residents do? Anyone experiencing flu-like symptoms and a characteristic rash or a rash alone should consult a primary care provider and get tested. Persons who have a new rash, like MPOX, should stay home and away from others. In other words, isolate and contact a primary care provider. Persons in close contact with someone suspected or confirmed to have MPOX should get vaccinated within 14 days, and preferably within 4 days. Healthcare settings and community vaccine pods have vaccine available for those at risk. And I'd like to thank you for your attention and introduce Deputy Director, Dr. George Ayala, for the next presentation. Thank you.
Thank you, Dr. Dunn, and good evening, everyone, and welcome. Next slide, please. I want to spend a little time talking about the Public Health Department's response to MPOX. And I'd like to start the presentation by sharing with you some of our public health principles of practice. Some of these were already kind of signaled or flagged in Director Watkins-Tartt's opening remarks to tonight's town hall. But I want to just emphasize these because these are how we organize our work in response to MPOX. And on the top of that list is health equity. And health equity means to us that we really kind of spend a lot of time being sensitive and understanding disparities in the impact that MPOX might be having, and also disparities that exist in our communities with respect to access to healthcare services. Our response is going to be data-driven, but it's also going to be community-informed. And those things, in my mind, in our minds, work hand in hand. We want to start our response by always assuming strengths as we're partnering with our communities in the response. And we want to be sex positive in our response. There's no space here for judgment. One of our important principles is about social justice and human rights, with the recognition that, health disparities only exist because there are social and structural issues that are at play that are responsible for why we see disproportionate impact in MPOX. And then finally, and equally important to us, is we want to ensure that all services that we provide are of high quality, are accessible, and are consumer facing. Next slide, please. Here are some of our goals and priorities in the MPOX response. We want to collaborate with community and healthcare partners on the public health response. It is critical that we do that. And from experience, we know that responses are stronger only in partnership. We're going to identify MPOX cases and close contacts. We're going to test. We're going to do contact tracing and timely identification of close contacts for vaccination opportunities. Prevention is a goal. We want to provide guidance and support for isolation for those with suspected or confirmed infection. We want to vaccinate persons at greatest risk for exposure, and we want to support accessible testing, isolation, and vaccination as needed. We also want to support treatment settings and treatment referrals, especially for most severe cases. We play a big role as a health department in vaccine allocation and vaccine administration to residents at risk. And included in that is the delivery of guidance for vaccination, allocation to healthcare settings and community clinics, as well as vaccine pods. We manage and disseminate the data for decision-making and future planning. And finally, we take a big role in infection control guidance for healthcare facilities, workplaces, and other settings. Next slide, please. Our priority here is to really reach and engage populations most impacted. And as you heard a little earlier, those populations, those communities include gay men and other men who have sex with men, gay men and other men who have sex with men who are Hispanic, Latinx, and Black African American, and gay men and other men who have sex with men living in low-income communities. Next slide, please. Here are some examples of the things that we've done so far. We have allocated vaccine to over 25 local community clinics and large healthcare settings, and we are in a fluid conversation with those partners. We are conducting large vaccine events, starting with the LGBTQ Center on Sundays. And upcoming, we will be partnering with Oakland Pride and Pride Fest, which are sponsoring their events on September 4th and September 11th. We will have vaccine pods there. We're going to be providing vaccine clinics twice weekly at the LGBTQ Center clinics and supporting weekly regional vaccine clinics such as SteamWorks. And the SteamWorks effort is a regional partnership with the state of California, the city of Berkeley, and SteamWorks itself. And these are really strong partners that I'm very proud of our partnership so far, especially with the LGBTQ Center. Next slide. I'm going to end with just kind of a brief discussion on our challenges. And on the top of the list here is limited vaccine supply. We get our supply from the state, and the state gets its supply from the federal government. And that supply is quite limited, and we get our supply from week to week. Another challenge for us is support for accessible services that are sensitive to the priority populations, and that is across the service continuum, including testing, vaccination, and treatment. We want to make sure that when we make those services available, those services understand how to engage the populations that are disproportionately impacted. Testing requires a medical home or a primary care provider, and that's a challenge for us. And treatment is not FDA approved at the moment and requires provider practice with substantial commitment and administrative capacity. And so we do have partners who have stepped forward and who have been delivering treatment for us as part of our response. And I think that's my last slide. And I think if we could turn to the next slide, yes, I'll turn it over again to Neetu. Thanks, Neetu.
Thank you, George. So I'm excited to say that we have a website dedicated to MPOX for Alameda County, mpx.acgov.org is our new website. Please feel free to visit it. You can find resources from both us, but also links to the CDC and TDPH's website. We do have during your regular business hours, Monday through Friday, we have staff on the phones available to help answer questions that you may have about MPOX, and an email where you can contact us directly if you have questions, concerns, or need connection to testing. If you believe you've been exposed or are experiencing symptoms of MPOX. So with that, we are going to transition to some of the questions that we've received in the Q&A. Again, that's going to be how we're asking you to share your questions with us. Please use that Q&A function. The first question that we had from our audience members is, what is the availability of vaccine and medication for MPOX in Alameda County? Dr. George Ayala touched on that, but Dr. Dunn, can I ask you to elaborate?
Certainly. Hi, everyone. So vaccine is widely available within Alameda County in both healthcare facilities, large healthcare facilities, as well as community clinics. So as George highlighted, our LGBTQ Center is providing twice weekly clinics, and we also have upcoming vaccine pods. So those would be larger events that may not require appointments. And I'd also like to point to our website. You can get more information on the vaccine page of the website about where vaccine is available. Thank you.
Thank you, Dr. Dunn. So the next question that we have, I'm going to stick on the topic of vaccine. Is the vaccine authorized for children ages 5 and up?
So the vaccine, vaccine can be given to children. There's special requirements for children, including a consent and certain processes needed, but the vaccine can be given to children who have been exposed to confirmed or probable monkeypox or MPOX. Thank you for that question.
Thank you, Dr. Dunn. The next question that we have is, again, sticking with vaccine. Do we have real world efficacy data, effectiveness data about the MPOX virus?
Yeah, for the vaccine is about 85% effective, and we are collecting more information during this outbreak. This outbreak is somewhat unique, and the real world effectiveness of the vaccine for the current outbreak is that information is being collected, and I think there'll be future information on the real world effectiveness of the vaccine. Over.
Thank you, Dr. Dunn. My next question for you is, how would one know that the symptoms that they're experiencing aren't symptoms of shingles or herpes or some other viral infection?
Yeah, thanks for that question. It's a great question. MPOX can mimic other infections, including shingles, herpes, sometimes secondary syphilis. So the best way to know of a characteristic rash is due to monkeypox is the testing that can occur. And testing is widely available in many healthcare settings for monkeypox. Often testing needs to be for monkeypox and other types of illnesses that result in rashes as well. Thank you.
All right, Dr. Dunn, I'm going to stick with you for now. The question that I am looking for is there concern about, I don't think we've covered this, if the vaccine is a live virus or that once you're vaccinated, you can spread the virus to others?
That's also a really important question. So the vaccine is made with an attenuated or inactivated virus, so it cannot cause disease nor spread the disease. Thank you for that question.
Thank you. So I might start with Dr. Ayala on this question, and then Dr. Dunn, you might provide any additional information that may be needed. So we've been told that this is only sexually transmitted. Would you please clarify? So I'm wondering if Dr. Ayala, you can start there.
Sure. It is not only transmitted sexually, and we do not consider MPOX a sexually transmitted infection. It is, however, transmitted through close contact, which can include sex. So it's important for folks to know. I don't know if Dr. Dunn wants to add to that, but.
George, that's perfect. No, nothing to add. Thank you.
So shifting gears just a bit, there's some questions just about cases. How many children I don't believe there are any, but how many children under 18 have been infected in Alameda County? And if we have numbers for either the state or even the country, that might be helpful context as well.
Yeah, for this outbreak, few children are involved. In Alameda County, we've had, as I presented, 167 persons with infection to date. One of those illnesses was in someone under the age of 18. But in general, all of the infections are occurring in adults. And there is really a close attention to any cases that are occurring in children. Thank you.
Thank you. And so sticking with children, is there information that school nurses should have to both recognize and to share information with their families or other members of their school communities? Dr. Dunn, if you wanted to start, and then Deputy Director Ayala, if you wanted to add anything on that.
Yeah, that's a great question. There is in development guidance from the state around considerations in school environments and for children. And there's a variety of different kinds of information that is available on symptoms that might be shared in those environments. We are also in Alameda County developing specific guidance for settings such as schools. And those will be posted on the websites when available.
Deputy Director Ayala, is there anything you would want to add?
No, I think Dr. Dunn covered it pretty comprehensively.
Great. And if you can actually stay unmuted, I'm going to direct this question to you. We had a question, what is a medical home?
I'm sorry?
What is a medical home?
Oh, I see. A medical home is where your primary care physician might be. So an example of that is Kaiser Permanente, Sutter, Stanford. Those are medical homes. So yeah, that's the answer.
Thank you. Shifting gears a bit to talk a bit more about cases. There are 167 cases at this time, probable or confirmed MPOX cases in Alameda County. We noted 64% are in Oakland. Is there a number that we would want to identify? 64% of those cases are in Oakland. I think we can do the math for folks.
Yeah, 67. It's actually 64% are in Oakland, and that translates into 107 residents.
Thanks. So there's a few questions in here about MPOX vaccine versus smallpox vaccine. Is the smallpox vaccine being utilized for MPOX? And I think, Dr. Dunn, if you wanted to start off there, but also just questions around, are both vaccines approved for use or authorized for use? And if any, if it's one or the other, if you could help clarify what those mean.
Sure. So many of you on this call may be, like myself, old enough to have received a smallpox vaccine when you were young. That is a different vaccine than what is available now, the Jynneos vaccine for the monkeypox outbreak. It's called ACAM 2000. There are two vaccines, ACAM 2000 and Jynneos. Jynneos is the vaccine that we're using for this to respond to this outbreak. They're very different vaccines, and the ACAM 2000 is not being used to respond to this outbreak in any health jurisdiction that I know of right now. So someone who may have gotten a smallpox vaccine as a child developed antibodies to smallpox, and some people still have some antibodies left, but over time they wane or go away. People who have had exposure to MPOX or have had an illness, some of those actually have had smallpox when they were a child. So if it is not fully protective for MPOX, especially so long ago. So So I hope that explains a little bit about the two vaccines, Jynneos and ACAM 2000.
And Dr. Dunn, if you could very quickly just touch on, again, if, something is emergency use authorization versus approved by the FDA. We just have a few different questions about that.
Yeah, thank you for that question. So the Jynneos vaccine is actually approved for use for prevention of monkeypox. So it's not under an emergency use authorization. However, the treatment for monkeypox called tecovirimat or TPOXX is under an emergency use authorization. The difference in those two processes means that in an emergency use, there's extra steps that have to be taken, sometimes a consent form, other forms that need to happen to use the product. So it makes it a little bit more challenging to use the treatment product. The vaccine, however, is approved for prevention of monkeypox.
Thank you, Dr. Dunn. This question is for Dr. Ayala. In comparison to COVID, the numbers are relatively small by comparison. Why is the strength of our response such that it is when the numbers are so different?
Sure. I would say our obligation as the public health department is to mount a strong response to whatever outbreaks come our way. That is true for monkeypox, MPOX, and it is also true for COVID. Yeah. So, and the other part of my answer is that we want to make sure we get out in front of an outbreak before it becomes more serious.
Thank you very much. And if you can stay unmuted, this next question is for you. Is there a way to share data on the intersectionality of queer, trans, and also someone who may be experiencing homelessness or disabilities or living with HIV?
Yeah, I think what we're trying to do is share as much data as we can, and that is available to us. Sometimes people who are impacted by MPOX don't share all of the data points that we might need to conduct, intersectional analyses. What we do know is that MPOX is disproportionately impacting gay, bisexual men and other men who have sex with men. That includes transgender men. Most of those men are Latinx or African American or Black. And most of those men live in low-income neighborhoods. So it does give us some information about the social drivers, the social structural factors that come into play when we're looking at how diseases impact disproportionately one population over another.
Thank you. And I appreciate the questions that are coming in. So once again, if you have questions, again, our presentation is until 6:30. We're going to get through as many questions as possible. And for some folks who are requesting the slides, we are planning on reaching out to everyone who is registered for the presentation. So we will definitely share the slides. So the next question that I have is there, and I think Dr. Ayala, this question might be for you. Is there any funding for FQHCs for vaccine administration?
Oh, it's a good question. At this point, I don't think there is, although the federal government is making some decisions about flexing different funding sources to permit FQHCs and other community clinics to participate more robustly in the MPOX response. And for those of you who work at an FQHC and are interested in some of those, we're happy to share that with you.
Thank you. Once again, I just want to make sure that this question is answered. I'm just seeing a couple questions that have come up again. Dr. Dunn, what is the age eligibility for somebody to get the MPOX vaccine?
So both children and adults can get the vaccine, but basically there's a required consent for children under the age of 18 years. So this is I'm talking about the Jynneos vaccine. It's a 2-dose vaccine that's spaced 28 days apart. We have had, it's important to note, there have been few children that have needed the vaccine because just in Alameda County, only a handful, a very few. That vaccine can be given in the many settings that I outlined, healthcare facilities specifically. The UCSF Benioff Hospital does have vaccine available for use for children. Over.
Thank you, Dr. Dunn. Let's see, we have a lot of great questions in here, and I want to make sure we're getting to as many as possible. So we have a question here about testing. How long does it typically take for results to come back? And I would want to clarify, if I'm remembering correctly, there's 2 steps. There's orthopox test, and then it's confirmed to be MPOX. So Dr. Dunn, if you want to just go ahead and explain how testing works and what the timelines look like, that'd be great.
Sure. So testing is very important for the response in this of MPOX, and testing is specifically, it's a swab of rash lesions, usually 2 to 3 of the lesions. And it's submitted to the lab. There's both commercial labs as well as the state lab that can do the testing. And the testing is usually, the turnaround time is within a week. We've had longer periods of time for the return of the result and shorter periods of time. So it varies a lot based on the lab that's doing the testing. But I'm really pleased to report that there's wide availability of testing, types of tests available, both commercial and state laboratory tests. Thank you.
Thank you, Dr. Dunn. This next question is going to you as well. What is the definition of close contact? This person would want to know in terms of how to adjust their workplace policies in case cases occur.
Yeah, the details of that are outlined, but it's primarily having had skin-to-skin contact or within a household of someone with MPOX or monkeypox. It's really this infection is primarily transmitted through close and intimate skin-to-skin contact. And so those are the definitions of close contact. And the details of what is a close contact vary on the setting, whether it's a household, an intimate partner, or a healthcare setting. And those are on our website as far as outlined different sorts of exposures. Thank you.
Thank you. So I'm going to actually answer this question. The phone number that we had on screen earlier, 510-268-2101. It is language accessible. So folks are welcome to give us a call Monday through Friday during normal business hours. And we're happy to help answer some of these questions as they come up. So the next question that we have, Dr. Dunn, is about second doses. When would the folks who have already received their first dose be eventually able to get their second dose?
Yeah, that's a great question. Thank you. So Alameda County Public Health Department is in alignment with the state and the region as far as prioritizing first doses of vaccine. And that's because of the shortages of vaccine supply. And this allows us to be using more vaccine to reach more persons who need the vaccine. Eventually, second doses will be given, and second doses are recommended for persons who are moderately or severely immunocompromised. And when vaccine supplies increase, the availability for second doses will be, communicated. We anticipate that that some people might have doses on schedule, and some people might have doses that are a little bit prolonged. Anyway, someone gets a second dose, they do not need to repeat the vaccine series. So thanks for that question.
Thank you, Dr. Dunn. Dr. Ayala, I have a question for you. What public communication and messaging efforts are being conducted about this local outbreak?
Sure, it's a great question. I think we are committed to these kinds of communications that are represented by this town hall. We plan a conversation with elected officials this week, and hopefully a kind of more intimate discussion with LGBTQ leaders to talk about the impact MPOX is having on the community. We have launched a website today, and it's a good source for getting information. And we have a line that people could call if they have questions. We are also partnering with organizations to get the word out, and we've issued a couple of health advisories to healthcare facilities and healthcare partners to keep them abreast of developments in this space.
Thank you very much. So my next question is, I'm going to ask both Dr. Ayala and Dr. Dunn to respond. I think there's a couple different ways that we would appreciate hearing a response. So Dr. Dunn, I'll start with you. What should one do if you see a person out and about with MPOX?
Thanks for that question. I think it's really important to know that it's hard to know for sure if someone has MPOX. There is a characteristic rash, but it can actually mimic other types of causes of rashes. Persons can have things like scabies, eczema, have other infections such as herpes or other things that are very similar to MPOX rashes. So it's not clear, it cannot be so clear to know if someone has MPOX or not. It's really important for persons that have characteristic rash to have testing and to isolate. The way the pathway for that is reaching to a primary care or a medical home for testing and communication. So I think that's what I would say is it's very difficult to know if a community member has MPOX or not. Thank you. George, you have something to add to that, I hope.
Yeah, just building on what you just offered, Dr. Dunn, I would say that it's really important for people not to jump to conclusions and to panic, right? If you know the person and they're visibly showing signs or symptoms, don't jump to conclusions about what that might mean. If you know that person, have a conversation and ask, have you had that looked at? Do you have access to a healthcare provider? And if not, this is the number you can call to get, testing for that. So I think it's really important to really exercise some kindness and when we're having these kind of conversations with one another, and not panic, not jump to conclusions.
Thank you both. So this next question is on isolation guidance. Dr. Dunn, I'll start with you. For a member of the public, if they're required to isolate, what is the guidance? But also, is there specific guidance for people who are experiencing homelessness or who may be in a shelter setting?
Yeah, that's a great question. So isolation means staying at home in your own room and hopefully your own bathroom. I fully realize that is a challenging recommendation for many persons in our community. It's not always easy to attain. And again, there's actually, the state has guidance right now that was recently released that provides details of what isolation means. And also provides some guidance around cleaning of spaces and cleaning of linens and towels that is very useful. So I think that's important. There is, through this new guidance, there's an opportunity for resuming limited activities outside the home if certain criteria are met. For example, if symptoms have resolved and if someone isn't working in a high-risk setting. So there are opportunities for some flexibility in that isolation guidance, depending on the person and depending on the setting. There are sometimes challenges for persons who are unsheltered to be isolated. And so we actually are working very closely with partners in the community on ensuring persons have a place to go to isolate if they need it. So partners such as Healthcare for the Homeless and shelter partners. So thanks for that question.
Thank you, Dr. Dunn. I'll ask both Dr. Ayala and Dr. Dunn to respond to this question. How can MPOX infection be prevented? I think there's, a couple different ways of thinking about this. So I'll ask maybe Dr. Ayala to start, and then maybe Dr. Dunn, you can help respond if necessary.
It's a great question, and I don't think we talk enough about prevention. And, my first response to the question would be, we have to get ourselves informed. Make sure you stay informed, stay on top of the latest developments, on the latest evidence, on the latest guidance. Our website is live. We have a live call-in to get the answers to the questions you might have. The second thing is that if you suspect that you or someone you know could have MPOX, really give them the advice of going to see their healthcare provider. And if they don't have a healthcare provider, to call a health department so that we could link you to a healthcare provider and to get that person screened. Besides that, I would recommend community members to just keep talking with one another and talking with one another with kindness, and to not jump to conclusions. Just get yourselves informed. Dr. Dunn, do you have anything to add to that?
No, I echo that. Thank you, George. I think it is really important that folks see a provider and stay home and isolate if they are confirmed to have monkeypox or they are likely to have it. And there's resources through medical homes and other settings for testing.
Thank you both. So this question, I'm going to start with Dr. Ayala. What toolkits are available from the county to provide LGBTQ+ organizations to fight homophobia, transphobia around MPOX? Is this information that could be shared on the new website?
That's a great question. We do not have toolkits that are specifically designed to combat homophobia, transphobia as it relates to MPOX. To me, that's an invitation for us to develop something, and I'd be happy to work with our partners to do that. I will also say that the state of California, CDPH, has really great toolkits that are more general, and I think they're very, very open to having any community partners adapt those toolkits for their own use. But I will take that as an invitation for the health department to lean in a little bit more in developing something that's more specific to the LGBTQ community most impacted in Alameda County.
Thank you, Dr. Ayala. I will ask you to stay unmuted. This question is for you. Working with BWOPA and Black and Vax efforts locally and statewide is the background of this person. As we continue to work to mitigate COVID exposure and increase testing and vaccination, specifically in Black and Brown communities, do we have any culturally relevant sources we can share? We're getting lots of questions.
Around COVID?
Around COVID is specific, but I'm also expanding this to MPOX. It's a part of our question.
Yeah, I mean, we have a number of organizations we're partnered with precisely to kind of message and to develop educational materials to engage community residents in a culturally and linguistically appropriate way in health literacy and in conversations about COVID, but also in strategies for linking community members to resources they might need, whether that be related to COVID resources, but other resources might come into play as we're having conversations. And those partnerships were specifically chosen because those partnerships, those organizations are from and represent the communities most disproportionately impacted. And with MPOX, we're doing a similar strategy. We're engaging with organizations we know who have good relationship with the communities that are most impacted. And that includes the Oakland LGBTQ Center, which has been an extraordinary partner to us.
Thank you, Dr. Ayala. And the clarification was they would like to add MPOX as they're getting lots of questions, and there is a lot of stigma.
There is a lot of stigma, and I think we need to work together to kind of figure out ways to interrupt that stigma. And, you know, I imagine that a lot of that stigma is related to homophobia and transphobia. And it is an opportunity, the outbreak is an opportunity for us to have the harder conversations with the Black and Latinx-led organizations who are serving our communities, but maybe not knowing that, and who've not taken public stance on engaging LGBTQ people who are Black and brown.
Thank you, Dr. Ayala. So we are getting close to the end of our presentation. We are going to end at 6:30. So if there are some outstanding questions that you've been holding on to, this will be the time to punch those into the Q&A. So Dr. Dunn, this question is for you. Do we know how MPOX virus came to be? Do we know how it came to exist?
Yeah, so this MPOX was first described in 1958, and what happened is some monkey colonies were infected with the virus and spread it within the monkey colonies, and thus the name monkeypox, and it's stuck around since that time. And primarily, MPOX or monkeypox in the past has occurred through exposure to an animal reservoir, usually small rodents. And so this outbreak is somewhat unique and different than previous outbreaks and previous episodic cases that have occurred. Thanks for that question. Over.
Thank you, Dr. Dunn. For folks who may have questions about vaccine eligibility, I'm going to just direct you to our website so we can get through a few more questions. It's mpx.ac.gov.org/vaccine. So that's where you can find eligibility information about vaccine. And Dr. Dunn, I'm going to ask you to, I know you answered this question earlier, but some folks may have missed it. If you were vaccinated for smallpox as a child, are you vaccinated against MPOX?
Yeah, that's a great question. You know, most of us who've gotten smallpox, we got it at a very young age, and our immunity has waned, or antibodies have gone away, and we don't have the protection from MPOX or monkeypox. We have had several cases that actually had a history of smallpox vaccination. So if someone has been exposed to someone as a close contact, either a person with confirmed monkeypox or probable monkeypox, they should get the JYNNEOS vaccine regardless of their smallpox vaccination status. Thanks.
Dr. Dunn. This question is about treatment. Is treatment available through a person's normal healthcare provider? How if you become infected with MPOX, how would one access treatment?
Yeah, that's a great question. The treatment is under a emergency use authorization, and there are a few settings in Alameda County that are providing TPOXX or tecovirimat treatment. We're focusing on a treatment for those illnesses that are very severe or likely to be very severe. And there's 2 sites we're working on, three additional sites throughout Alameda County. I believe that information's on our website, but if it is not, I can provide that. We can provide that on our website to follow. So I'll need to wrap around on that. Thank you.
Thank you, Dr. Dunn. I'm going to try to get through as many of these as we can. I appreciate everybody's questions, but we do want to get folks out on time. With that, are there, Project Room Key was isolation housing available for COVID. Is there a similar availability of isolation housing for folks who may need it for MPOX?
So that's a great question. What we are doing at Alameda County Public Health Department is in situations in which there's a challenge with shelter or housing, we are working very closely with our partners to ensure there's isolation. We do have the availability of isolation hotels to utilize on a case-by-case basis. And so we would work on a case-by-case basis with both the shelter setting or healthcare for the homeless. Thank you.
Thank you. All right, so we have a few questions in the chat, continuing to ask about the MPOX vaccine. I'm going to direct folks to our website, and we'll continue to add information there. So this question is more about the risk of spread of MPOX in congregate settings like nursing homes and group homes. Is that, we saw that with COVID, is that concerning for MPOX?
Yeah, to date, we have had few cases in congregate settings, but this is a challenging environment, as we know from COVID, for infection control and preventive transmission. So, on the congregate settings, such as long-term care facilities or other environments like that, we work very closely with those facilities and the patients to ensure, a vaccine is available if needed, and isolation steps are done in the cases of probable or confirmed infection. I hope that answers the question.
Thank you, Dr. Dunn. So I'm going to take, this may be our last question, but if we can get in one more, we will. So the question is, MPOX is spread from close skin-to-skin contact. Does that mean it can be spread from something like touching items like linens or workout equipment in a gym?
Yeah, that's a really good question. So it's primarily transmitted by skin-to-skin contact between 2 people. However, linens or towels or other porous items that touch a rash can transmit the illness to another person. So it's really important that linens and clothes and towels that might touch a rash are handled carefully. And there's recommendations on how to launder those clothes and how to keep clothes and linens in a special place so that they don't create new exposures to other people in the household. Thank you.
Thank you, Dr. Dunn. So I know there's still a few questions in the chat. We will follow up with folks individually if we can. Otherwise, we'll add more information to our website regarding vaccine. I know there's a lot of questions about vaccine. So we appreciate those questions, and they will help us expand the content that's available there. So with that, I want to thank Our speakers, Director Kimmy Watkins-Tart, Deputy Director Dr. George Ayala, and Dr. Eileen Dunn. I want to thank our interpreters for their great work, and all the folks who joined us tonight to hear this presentation. We hope that you take this information, share it. As you heard Dr. Ayala say, we hope you're talking to your friends and family and neighbors about this. They may not have joined us on this presentation, but you did. So we hope that you will share this information, direct folks to our website. As mentioned earlier, we will share these slides for my Spanish speakers. We'll need some time to translate the slides, but we'll do that and make those available. Once again, thank you so much for being here. You can always revisit this on our YouTube page, Alameda County Healthcare Services Agency. The recording will be there for your enjoyment. So have a great evening and a great weekend. And again, mpx.acgov.org, 510-268-2101, and monkeypox@acgov.org are the ways to reach us online or by phone. Have a great night, and we will see you around. Thank you.
Good night, everyone.